Hello and welcome to Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about the community health programs that St. Tammany Health System is a part of or has to offer. We'll first speak with St. Tammany Health System CEO, Joan Coffman. She'll talk to us about a North Shore-wide community health initiative called Healthier Northshore. And then we'll speak with Ann Pavlovich about a mobile health unit called the Be Well Bus. And last, we'll speak with Aaron Strain, who will talk to us about corporate health solutions. So Joan, let's start with you. Welcome to the show.
Good morning.
Thank you so much for coming.
Oh, thank you for having me.
We're excited to have you in the studio. So we were talking a little bit about Healthier Northshore, and that is bigger than St. Tammany Health System. That is a North Shore-wide initiative. So can you talk a little bit about, from a big picture perspective, what is Healthier Northshore?
So Melissa, we are so excited to have launched Healthier Northshore, and quite honestly, we just launched a year ago in September of this year. So it really is in its infancy, but to see the magnitude and the impact and the momentum we've taken so far, it's just extraordinary. So what is Healthier Northshore? Healthier Northshore is really a vision that will bring people together from healthcare, government, and the not-for-profit sector. And we are focused on improving the health and overall quality of life of our area residents in both Washington and St. Tammany Parish. And we're looking to do that through areas such as education, early prevention, and certainly connecting to local resources.
Okay, so it really sounds like from all the way from Lake Pontchartrain right up into Washington Parish to the Mississippi line, we have people in our industry in healthcare, but elected officials and not-for-profits like chambers of commerce and other civic organizations that are all looking at the overall health of that population of people who are in St. Tammany and Washington. And I think we all know those numbers are terrible, but we want to get better. And so that's the idea behind Healthier Northshore.
It certainly is. And you know me, I have to start on a positive note. So when you think about St. Tammany Parish, for example, we ranked number 2 in 2020 as the healthiest parish in the state of Louisiana. That's a huge win. However, as you said, when you look at the health rankings nationally, the state of Louisiana, unfortunately, is at the bottom in the 50th position, and that's just not good enough. We really feel we have a responsibility to educate, to provide information to our public so that we can partner together with all these wonderful constituents that support our community so well to really raise the bar and move those metrics.
Well, good. And the 3 things that you talked about, the first was education. So our education committee of Healthier Northshore is focused on not just the schools, but also educating adults. And so I think if we think about that from the education standpoint, we have a tendency to throw ourselves into the school system, and that absolutely is a wonderful way to get information out. And then beyond that, also with adults, to be able to teach healthy lifestyles and healthy choices.
You're absolutely right. And when you think about the focus of this work, you know, there's a lot of resources out there. There's a lot of education that is available, but we want to work together. So you'll see kind of cross-cutting measures taking place between the 3 committees, education, early prevention, and then connection to resources. So when you think about the group that's focused on education, it's all populations. We want to educate those who are I say career, but mid-age, but also those in more of a seasoned state, as well as the youth, because the youth are really the ones that are going to help us to change the course.
Right, and so beyond education, in terms of connecting to resources and prevention and detection, there's really a flow there. I'm thinking about the community gardens that Healthier Northshore is working to bring to life. That's an opportunity to teach people about sustainable food resources, but it's also a way to bring fresh, healthy food into households.
That's absolutely right. We're very fortunate that this group has already identified a site on the Safe Haven campus to build a community garden. And what they're going to do is not just have the garden available, but invite people to come in, to your point, so that they can learn how to truly provide themselves sustaining healthy food sources.
Wow. I think that's a wonderful initiative that really, it's an initiative of the Education Committee, but you can see its ramifications in all three aspects of Healthier North Shore. Similarly, I know that the Early Detection Committee is looking at nicotine cessation, not just smoking, but vaping and chewing, that the consumption of nicotine is damaging to our whole population, and they are looking at ways to educate and to connect people with the resources to quit. And so there's another nice flow in nicotine cessation.
You know, to your point, everything crosses over. So coming back to education, you know, one of the other things that they're really focused on is, you know, healthier lifestyles. So when you think about the community garden, folks come out, they garden, they're active, you know, that makes a difference. And then you move into early detection and the work that they're doing with smoking cessation and vaping. Smoking cessation because it still exists pretty pervasive in our markets. And we want to hit vaping because that's really something the youth has really tagged themselves to. So we're working with that early detection team to really educate on the value of not smoking and working with municipalities and government to the point about, you know, the broad array of resources we have in our advisory council to help to really set that standard.
Perfect. And so I think we've got a nice example of the Education Committee at work and the outreach. There's also the behavioral health piece of it that I think is in both of those committees as well as Connect to Resources. And that behavioral health aspect, you mentioned the Safe Haven campus as where the community garden will be, but there are also so many other resources, including NAMI and other behavioral health resources that we can connect people to through Healthier North Shore.
You're absolutely right. And you know, unfortunately, even pre-COVID, mental and behavioral health was a concern for our area residents, and that has exacerbated with the pandemic. So we're so excited to see that not only the education team, but also the early detection teams are working hard to really improve the access to care and service in those areas. And to your point, the Safe Haven campus is a wonderful resource that we have in our community and quite honestly across the region.
That is beautiful. And I know with each of these committees and with the executive committee leadership, you have individuals and organizations represented from St. Tammany and Washington parishes. And I know that there is a movement afoot to try to coalesce this information into a website, a Facebook page, and a brochure so that each of these 50 organizations that have volunteered to be a part of this can connect the public with the Healthier North Shore opportunities.
Well, Melissa, you probably have a lot to say about that. I really want to do a big shout out, first of all, because Nick Richard with NAMI is leading the education subcommittee and doing a fantastic job and pulled together an extraordinary team to help to support that effort. Rhonda Bagby, who is with Bright Health, she really has been a thought leader for over 20 years in our community, just really helping to raise the awareness of, you know, healthy living. And then with our Connect to Local Resources, we have Chris Massengel. He's with the St. Tammany Corporation. You know, when you have a healthy area to live in, what a great way to grow the economy and really enhance our economic growth and development. So through that effort, there is a subcommittee, and they are focused on creating, as you know, an area website that will be able to be distributed probably by the end of September to the broader community so that they will know exactly where to go to connect to those local resources.
Right. Well, Joan, thank you so much for teaching us about Healthier North Shore. It's been a pleasure to have you with us.
Oh, it's been my pleasure. This is a real pearl to me for our community, both in St. Tammany and Washington Parish, and very excited to be involved.
Thanks. You've been watching Healthy Living, and we're talking today about community health resources in St. Tammany and Washington parishes. We talked to Joan Coffman about Healthier North Shore, and up next, we'll hear from Ann Pavlovich about the Be Well bus. We'll be right back.